Antimicrobial resistance, AMR, is one of the most critical global health challenges of our time. As pathogens evolve to withstand the medications designed to kill them, the world faces the growing threat of untreatable infections. AMR puts millions of lives at risk, threatens modern medicine, and has far-reaching economic, social, and healthcare consequences. Without immediate and coordinated action, AMR could undo decades of medical progress and lead to a global health catastrophe. AMR is no longer a future threat. It is a present-day reality. According to the World Health Organization, WHO, at least 1.27 million deaths were directly caused by antimicrobial resistance in 2019, and nearly 5 million deaths were associated with it. In the United States, more than 2.8 million infections occur annually due to drug-resistant pathogens, resulting in over 35,000 deaths. Projections suggest that the situation will worsen dramatically. By 2050, AMR could cause 10 million deaths every year, more than the current death toll from cancer if no action is taken. The economic costs are equally staggering, with estimates pointing to a potential cumulative global loss of $100 trillion by mid-century, due to the strain on healthcare systems and reduced productivity. A case study, the superbug crisis in conflict zones. Conflict zones are particularly vulnerable to the spread of antimicrobial resistance, AMR, creating a dire public health crisis in areas already grappling with war, displacement, and inadequate healthcare systems. Overcrowded living conditions, poor sanitation, disrupted medical infrastructure, and widespread misuse of antibiotics fuel the rapid emergence and spread of drug-resistant infections in these regions. Hospitals and healthcare facilities in conflict zones often operate under extreme strain, leading to limited infection control measures and over-reliance on broad-spectrum antibiotics. These antibiotics, frequently used as a stopgap in the absence of diagnostics, contribute to the development of resistant pathogens. One particularly dangerous superbug, Klebsiella pneumoniae, has become increasingly prevalent in conflict zones. Klebsiella pneumoniae is a bacterium commonly associated with hospital-acquired infections, such as pneumonia, bloodstream infections, and surgical site infections. In many cases, these strains are resistant to carbapenems, a last resort class of antibiotics. The Middle East, an epicenter for resistant infections. War-torn regions such as Syria, Iraq, and Yemen have become hotspots for AMR. A 2021 study published in The Lancet Global Health revealed that more than 70% of bacterial infections in Syrian refugees were resistant to at least one commonly used antibiotic, including penicillins and cephalosporins. These infections were linked to overcrowded refugee camps where sanitation facilities were inadequate and access to clean water was limited. 1. In Iraq, a 2019 study found that 64% of Klebsiella pneumonia isolates from patients in conflict-affected areas were resistant to carbapenems. 2. In Yemen, ongoing cholera outbreaks, fueled by poor water sanitation, have been complicated by the rise of multi-drug-resistant Vibrio cholera. Ukraine, a recent crisis. The Russian invasion of Ukraine in 2022 triggered a surge in antibiotic-resistant infections. A report by the WHO in 2023 revealed that hospitals in conflict-affected eastern Ukraine were facing outbreaks of extensively drug-resistant XDR tuberculosis, which does not respond to most available antibiotics. Additionally, resistance rates for infections caused by Acinetobacter baumannii, another hospital-associated superbug, exceeded 80% in some Ukrainian medical facilities. Wounded individuals in conflict zones are particularly susceptible to resistant infections. Open wounds, often untreated or inadequately sterilized, provide an entry point for bacteria. In regions such as Gaza, where hospitals frequently experience shortages of sterilization supplies, this has led to soaring rates of surgical site infections caused by drug-resistant bacteria. 1. A 2018 study conducted on injured Syrian refugees treated in Jordan found that 64% of wound infections were caused by multi-drug-resistant organisms, with Acinetobacter baumannii being the most common. 2. In Afghanistan, U.S. military hospitals reported that more than 60% of infections in injured soldiers between 2009 and 2013 were caused by multi-drug-resistant bacteria. International response to combat AMR in conflict zones. Efforts to address AMR in conflict zones involve a mix of emergency interventions, international aid, and public health strategies. Organizations such as Médecins Sans Frontières, Doctors Without Borders, and the International Committee of the Red Cross, ICRC, have established mobile clinics and field hospitals to provide timely and effective care for injured civilians and combatants. These facilities aim to improve infection control practices, such as sterilization and wound care, to reduce the reliance on antibiotics. The WHO and United Nations High Commissioner for Refugees, UNHCR, have launched initiatives in refugee camps to regulate antibiotic distribution and educate healthcare workers on appropriate usage. In one program conducted in Syrian refugee camps in Jordan, antibiotic prescription rates dropped by 15% between 2018 and 2020. International aid organizations have focused on improving access to clean water and sanitation in conflict zones. For instance, UNICEF's WASH, Water, Sanitation and Hygiene program, has provided sanitation facilities and clean water supplies to millions of refugees in the Middle East, helping to curb waterborne infections and reduce antibiotic usage. Global initiatives like the Global Antimicrobial Resistance and Use Surveillance System, GLASS, have expanded their monitoring efforts to include conflict-affected areas. These programs aim to track the prevalence of resistant pathogens and inform targeted interventions. The numbers tell the story. 70% of bacterial infections in Syrian refugees are resistant to at least one antibiotic. The Lancet Global Health, 2021. 80% resistance to critical antibiotics like carbapenems for Acinetobacter baumannii in Ukrainian hospitals, WHO, 2023. 64% of wound infections in Syrian refugees treated in Jordan were caused by multi-drug-resistant bacteria. The crisis of antimicrobial resistance in conflict zones is a stark reminder of how war and instability exacerbate global health threats. These regions serve as reservoirs for drug-resistant pathogens that can spread to other parts of the world, making AMR a global concern. Addressing AMR in conflict zones requires a multifaceted approach, combining improved healthcare infrastructure, sanitation, and international support. Without urgent action, the superbug crisis in these vulnerable areas will continue to grow, posing a severe threat to global health security. How did we get here? Several factors have contributed to the rapid escalation of AMR. 1. Overuse and misuse of antibiotics. Antibiotics are often overprescribed in healthcare settings and used indiscriminately in agriculture, accelerating the emergence of resistant strains. In some countries, antibiotics are even available without a prescription, further exacerbating the problem. 2. Inadequate regulation. Weak oversight of antibiotic use in both human medicine and farming has enabled resistance to thrive. 3. Poor infection control. Limited access to clean water, sanitation, and proper hygiene, especially in low and middle-income countries, creates an ideal environment for resistant pathogens to spread. 4. Slow development of new drugs. The pharmaceutical industry has largely abandoned antibiotic development due to high costs and low profitability, leaving the world reliant on decades-old drugs. Innovative research and breakthroughs. Amid the challenges, there are promising breakthroughs in AMR research. On January 21, 2025, Australian scientists announced the discovery of a protein in the blood of Sydney rock oysters, Sarcostrea glomerata, that could revolutionize how we combat drug-resistant bacteria. This protein, part of the oyster's immune defense system, can disrupt bacterial biofilms, thick protective layers that shield bacteria from antibiotics. These biofilms are a major reason why infections persist and resist treatment. Laboratory tests revealed that the oyster protein could enhance the effectiveness of existing antibiotics by up to 32 times, making even resistant bacteria vulnerable to treatment. Importantly, the protein was found to be non-toxic to human cells, paving the way for its use in medicine. Dr. Melissa Thompson, lead researcher at the Australian Institute of Marine Biology, stated, "This discovery is a game-changer in the fight against AMR. Nature often holds the answers to our most pressing challenges, and the Sydney rock oyster may provide us with a powerful tool to combat resistant infections. While we are still in the early stages of research, the potential applications are vast, from treating chronic infections to preventing biofilm formation in medical devices. The discovery highlights the importance of exploring natural solutions to AMR. While further research and clinical trials are needed, the oyster protein represents a promising new tool in the fight against drug-resistant infections." Economic and social impacts. The economic and societal consequences of AMR are profound and far-reaching: healthcare costs and strain. Treating drug-resistant infections is significantly more expensive than treating non-resistant ones. Patients often require prolonged hospital stays, expensive last-resort antibiotics, and intensive care. In the United States alone, AMR adds $4.6 billion annually to healthcare costs. Globally, this financial burden is expected to grow as resistance spreads. Hospitals, especially in low-resource settings, struggle to accommodate the growing number of patients with resistant infections. The strain on healthcare systems leaves them less prepared to handle other emergencies, such as pandemics or natural disasters. Global productivity losses. AMR also reduces economic productivity. Resistant infections can render people unable to work, sometimes for extended periods, and can lead to premature deaths. This loss of human capital has ripple effects across industries and economies. A 2014 study estimated that AMR could result in a cumulative economic loss of $100 trillion globally by 2050. Threats to food security. AMR poses significant risks to global food systems. Antibiotics are widely used in agriculture to promote growth and prevent disease in livestock, but this practice has fueled resistance in bacteria that can spread to humans through food. Resistant infections in livestock and crops threaten global food supplies and drive up the cost of meat and dairy products, disproportionately affecting low-income populations, worsening inequalities. AMR exacerbates existing social inequalities. In low-income countries where access to advanced medical care is limited, resistant infections often go untreated, leading to higher mortality rates. Women and children are particularly vulnerable, with maternal and childhood mortality rates increasing due to untreatable infections like sepsis and pneumonia. The path forward. Addressing antimicrobial resistance, AMR, requires a comprehensive and coordinated global effort across governments, healthcare providers, industries, and individuals. The scale of the crisis demands innovative solutions, robust policies, and a commitment to international collaboration. Several key strategies are already being implemented or proposed, but these must be scaled up urgently to prevent AMR from spiraling out of control. Antibiotic stewardship programs. Antibiotic stewardship programs, ASPs, are initiatives designed to optimize the use of antibiotics, ensuring they are prescribed only when necessary and used correctly. These programs focus on preventing overuse and misuse of antibiotics, which are key drivers of AMR. Case study: the UK's success with ASPs. The United Kingdom has been a global leader in implementing ASPs. Between 2014 and 2018, the UK reduced antibiotic prescriptions in primary care by 17%, according to the UK Health Security Agency. This was achieved through public awareness campaigns such as Keep Antibiotics Working, to educate patients on the risks of misuse. 2. Introducing clinical guidelines for physicians to reduce unnecessary prescriptions. 3. Providing financial incentives to healthcare providers who meet antibiotic reduction targets. As a result, the UK saw a decrease in the prevalence of drug-resistant pathogens like Escherichia coli in hospitals. Similar models are now being adopted in other countries. Global ASP efforts. In the United States, the Centers for Disease Control and Prevention, CDC, has implemented a national action plan for combating antibiotic-resistant bacteria. Between 2012 and 2017, efforts to improve antibiotic prescribing in hospitals led to a 20% reduction in inappropriate antibiotic use. However, the CDC emphasizes that much work remains, particularly in outpatient settings where misuse is still rampant. Preventing infections in the first place reduces the need for antibiotics and, by extension, the risk of resistance. Infection prevention measures include improving hygiene, promoting vaccination, and ensuring access to clean water and sanitation. Case study: the Gavi Alliance and vaccine rollouts. Vaccines play a crucial role in reducing the burden of infections that would otherwise require antibiotics. For example, the pneumococcal vaccine has significantly reduced cases of bacterial pneumonia, a major driver of antibiotic use. According to Gavi, the Vaccine Alliance, more than 225 million children in low-income countries have been immunized against pneumococcal disease since 2000, preventing an estimated 700,000 deaths annually. In addition, the WHO has highlighted how improved vaccination rates against diseases like measles, typhoid, and cholera have reduced the reliance on antibiotics in endemic regions. Hygiene and sanitation. Basic sanitation improvements have profound effects. In India, the Swachh Bharat Abhiyan, Clean India mission, launched in 2014, focused on eliminating open defecation and improving access to toilets. By 2019, the program reportedly provided 110 million households with toilets, reducing waterborne illnesses that often necessitate antibiotics. Incentives for drug development. One of the greatest challenges in combating AMR is the lack of new antibiotics. Developing antibiotics is costly and time-consuming, and pharmaceutical companies often deprioritize these drugs due to their low profitability. Incentives are crucial to reignite interest in antibiotic research and development. The CARB-X initiative. Combating Antibiotic-Resistant Bacteria Biopharmaceutical Accelerator, CARB-X, is a global public-private partnership dedicated to funding early-stage antibiotic research. Since its launch in 2016, CARB-X has invested over $500 million in 92 projects across 12 countries, focusing on innovative therapies, vaccines, and diagnostics to address AMR. Case study: phage therapy in Georgia. Georgia's Eliava Institute has pioneered phage therapy, using viruses that infect and kill bacteria as an alternative to antibiotics. While phage therapy remains underutilized globally, countries like the US and the UK are now funding clinical trials to explore its potential. Pull incentives for antibiotic development. In 2022, the US Congress proposed the Pasteur Act, which would offer companies up to $3 billion in pull incentives for successfully developing new antibiotics. This legislation aims to stimulate innovation while ensuring newly developed antibiotics remain affordable and accessible. Public awareness campaigns. Educating the public about the dangers of antibiotic misuse is essential for slowing resistance. Misunderstandings about antibiotics, such as using them to treat viral infections, are widespread and contribute significantly to misuse. Case study: WHO's World Antibiotic Awareness Week. The WHO's annual World Antibiotic Awareness Week aims to improve understanding of AMR and promote responsible antibiotic use. In 2022, the campaign reached over 5 million people through social media and partnered with governments to conduct community workshops in rural areas. Behavioral changes through education. Public campaigns in Scandinavian countries have led to a cultural shift in how antibiotics are perceived. Sweden, for example, has one of the lowest rates of antibiotic use in the European Union. This is largely attributed to sustained public health campaigns that emphasize the importance of reserving antibiotics for severe bacterial infections. Global cooperation and surveillance. AMR is a global issue that transcends borders. Countries must work together to share data, resources, and expertise. The Global Antimicrobial Resistance and Use Surveillance System, GLASS, launched by the WHO in 2015, collects data on AMR patterns from over 70 countries. This system helps identify resistance hotspots, track emerging trends, and guide targeted interventions. The One Health approach. The One Health initiative emphasizes the interconnectedness of human, animal, and environmental health in addressing AMR. For example, in the Netherlands, strict regulations on antibiotic use in livestock have reduced agricultural antibiotic consumption by 64% since 2009, without compromising food production. This has also contributed to lower rates of resistance in humans. The urgent need for action. The path forward is clear but fraught with challenges. If AMR is not addressed, humanity risks returning to a pre-antibiotic era where routine surgeries, childbirth, and minor infections become life-threatening. Yet, with concerted global action, it is possible to mitigate this crisis. The stakes are immense, but the solutions are within reach. Governments must invest in research and innovation, enforce stricter regulations on antibiotic use, and ensure equitable access to healthcare and sanitation worldwide. Individuals, too, have a role to play by using antibiotics responsibly and supporting public health initiatives. In the fight against AMR, every action matters. Together, we can protect future generations from the devastating consequences of drug-resistant infections. The time to act is now. If you found this information valuable, hit the like button, share this video, and subscribe for more updates on global health issues. And remember, every time you use antibiotics responsibly, you're making a difference. Thanks for watching.